Hello? Well, hi there. How are you? What do you mean, where am I? I'm at home. Where are you? Well, what are you doing at the mall? Well, if you wanted me to come to the mall, you should have called me. I can't read your mind. What do you mean you did? Who'd you talk to? No, I didn't talk to you. I don't remember if I talked to you. I hadn't talked to you in, I don't know, a month or so. You did not call me. Maybe you called the other one. Listen, I mean, I hate saying this because I hate even bringing it up, but I think you best go see the doctor. Because I think you may have that dementia they talk about, because I think you're all turned around, sweetheart. All right, well, bye-bye. All right, so at your table, I want you to do a quick review of what's normal and what's not. So go through the laundry list of everything we've talked about and see if you can highlight some of the things of not normal.
Okay, what was not normal? Let's talk about that. So I need your participation here. So you just,
Forgetfulness and who's on the line.
okay, forgetfulness was on the line.
Thinking people were taking things.
Oh, yes, hiding them and storing them.
So how is it different from what was normal? So we talked about certain ideas and you know, there are, how many thoughts can we hold at in our working memory that Tipa talked to us about? 5 to 8,
Yeah.
right? How many can somebody with dementia can hold?
Not much.
Yeah.
Not much. I don't know how much.
Ability to recognize who's on the phone. You know, when somebody calls and says, hey, guess who this is? You know, what's going to happen to somebody with dementia? Are they
And
gonna-
then discussing and telling them what they think of them and their appearance and so on. You need to lose some weight and.
So what was that?
Hmm?
What was that? What is it that they're doing?
Oh, they're criticizing.
Yeah, but so do they have a filter as we get
No,
older?
No, they aren't. They
You know,
aren't.
as adults,
they
we-
aren't able to
Yeah.
to know what is the polite thing to do and what is the.
Is it intentional?
No,
No?
not at
Not
all.
at all. Do they know they're doing it?
Not. I don't think they do.
No, they don't. No, that's the main difference is that they're not, again, when we talked about earlier on, how, you know, think of kids having no, the ability to, yeah,
Retain information.
or safety awareness, or being polite, you know?
Right.
You're young, as a child, you don't know those things. Same thing happens with somebody with
They did
dementia.
not.
And how did
She
you get
didn't
to the
remember.
store?
She had the dirty coffee cup.
What else? Can they use auditory cues, like, you know, talking to themselves to recall what they need to do? Someone with dementia.
She didn't even do that.
She was talking to herself going into the kitchen? I don't know.
But
Yeah, but did it help?
did it help though? She did talk, but did it help?
Not really.
Not really, no.
Well, she just saw the dirty coffee cup.
Because
Right.
what
Yeah,
happens
that's right.
here,
No.
And
you know, with somebody with dementia, when Tipa talked about here, is there's complex wiring that happens between here, 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 and here, that it's not working properly. So none of those things are triggering. All right, let's take a look at what Tipa has for a list, and then what we discussed here.
Talk about your not normals.
So, as part of normal aging, we're slower to think, we're slower to do, we hesitate, we're more likely to look before we leap, will know a person but not their name, because visual we can store longer. May pause when words for word finding, and new data reminds me of old data. With not normal aging, we're unable to think the same, unable to do the same as I did before. We're unable to start tasks. We'll get stuck in a moment of time. We're unable to think things through. We're unable to successfully recall a person's identity. Words won't come even with visual, verbal, or touch cues, and we'll be confused about past and present, and personality and or behaviors will be different. Any questions on these?
No, it makes me feel more comfortable about myself because I think that I really, on my way to dementia now, I realize it's normal aging.
Good. So we're going to pair up again in partners, and we're going to discuss how comfortable you are with recognizing the difference between normal and not normal type of behaviors, such as language, thinking, processing, remembering. On a scale of 1 to 10, rate where you think you are with your knowledge and assessment skills of normal and not normal aging. So basically we're going to partner up and we're going to discuss what we just learned and how comfortable you are and how you're able to utilize this in yourself and being able to assess between normal and not normal. How comfortable are you?
Some things which I thought might
I feel a little better about what we learned.
symptoms, dementia, not just normal aging.
Good.
Because I'm very
Seeing my friend, and I hadn't seen her,
aware of not being able to
her
afford
husband, they
something
came back
from my
from
head
Indiana
and
last a year.
being
and had I could see the
word.
difference.
Yeah, so
And
you
I
had
think
to
they
get.
get
You were-
Anybody
yourself.
meeting him
And
did not
actually,
get
it is
1
know
to
the
10,
difference.
I can tell every single time whether it's normal or not normal.
that makes me
We went out to
nervous.
dinner, where were you?
Since we
And she had to remind him, use the knife,
Tell me your name.
cut
Beverly
your meat. Well, she cut
I'm
it.
Mary Ann Wolf.
and
We live here
Here's,
in
here's your,
independent living.
here's your napkin.
Here's your husband's at the beginning stages
Assistant.
he is.
and doesn't think there's anything wrong.
You see, that's what my husband.
But would it be normal aging if you have to assist someone to cut up their food?
We just
Somebody with
did
arthritis
our last
still want to help.
Or 2 or
and,
3 or
we
closer to
had one of
7 or 8.
those,
I mean, I can't, I have
VW,
arthritis, and it's hard for me to open a jar,
Well,
but
cars that
I
you
know I
want to
couldn't
get
get
off.
or get the jar
Because
open.
they
Yeah,
were,
we used the tool, right?
had,
Yeah.
see, I've got a
And, you know, do you have to,
Did you move here locally?
no, we moved from Wisconsin
to
to,
it's not
4 years ago, we moved from
four.
Wisconsin to Sean.
So I'm just going
Our
to bring us
daughter.
back to
Yes, our daughter lives there.
the
And she
program.
was alone, her 2 children
Six.
were in college.
Rosemary.
and
So what are
so we
some,
know
Rosemary,
whether she asked us to come and live with her.
right word.
So we
Rosemary?
lived with
Rosemary,
her for a year.
she wants to get your
so
attention.
we're just going to discuss what are some key things you can listen for, look for, and consider that you would help tell you the difference between aging and not, between normal aging and not normal aging. What are some things you would look for, you would consider? Anything you guys discussed, Jess, you wanted
yeah,
to?
she actually had a really, tell me your name one more time, I'm so sorry. What's your name?
Clarice.
Clarice had a great point. She said, when people start to not be able to find the words,
Mhm.
like not just that pause, but actually not be able to find them eventually.
Mhm. You had a good one. About your
There's a
friends.
personality
Oh,
trait.
yes. I could
after not seeing somebody in 3 years, and I saw him again, he knew who I was, but I could see the difference. When the three of us went out to eat, she had, my friend had to tell him, don't forget to use your napkin, or don't forget you gotta use the knife to cut the meat. Or would you like me to cut it for you? Things like that. By the way, I called Mary Ann Rosemary.
Yes, you did, I noticed that.
And is that part of normal aging?
I confuse a few people here,
But that's, but
I
it's,
know quite a few people, and then I say, oh, why'd they call them the wrong name?
but it's part of normal aging.
Well, you know of Rosemary also.
I know.
Yeah. What about Mary Ann?
Oh, I think the thing, I see a difference, I see a personality change.
Okay. Okay. Personality change. Okay.
And I've noticed a couple people here that when I would talk with them, sometimes they would be angry with me, and sometimes they'd be very nice. And I realized that it was just the day.
Mm-hmm.
The day was different.
Because it's their, is it, that's who they are, or is that the disease? No, I'm asking you, is that who they are, or is that the disease that's,
I think it's the disease.
yep, perfect. What about you?
I find my husband has more of a dependency on me. And I like to keep him independent,
Okay.
doing for himself.
Okay.
And that's what I try to do, as long as he can.
So we're going to think of 1 or 2 situations where you can look for, listen for, or pay attention to the possibilities of not normal where you live. Tell your partner the specifics of when and where you will practice your skills of recognizing what is not normal, aging, and identify at least one specific thing you'll be noticing. So you live in an environment where people are aging, and what are one thing you're going to look for that's not part of normal aging? That's going to say, bing, okay, this doesn't, it's not part of normal aging that we learned about today.
I noticed yesterday when it was with a particular person coming from someplace, you thought it was dinner time, but it was only 3 o'clock. Instead of, I thought it was like going on 6.
So not aware
And
of
when he was
time.
told, he said, oh, I have time, I can take a nap before dinner.
It's a great example.
What about you?
I think another thing I noticed, that I wonder whether it's normal or not normal, was they used to be, person used to be more gregarious, and now they're more trying to stay in the background. I don't know if that's
No,
normal.
I think that's it.
Personality changes?
Yeah, personality change.
Yeah.
Yeah. Yeah, and that's one of the things we'll learn in our next seminar is why somebody does that.
Mhm.
So we're back to Tifa. Jessica, take it from here.
I'm gonna take you through and see how many things you picked up on that I know. Let's see how good you are. You're pretty good, I bet. So when I answered the phone, did I actually know exactly who I was speaking to? So I was unable to take the voice print and match it to the person that I know. So the challenge here is I covered a little bit. Hey, sweetheart, of course I do. Yeah, Betty who? Because I got Betty, she told me Betty, but even with Betty, even with the name, I couldn't get across to the other side of my brain, recognize the voice print, and go, oh yeah, that's who it is. I had to have help to get back across and find the last name and hook it into the picture that I have in the back of my brain. My wiring's not working quite right. Now that could have been a stroke, It could be inattention, it could be that I know a lot of Bettys, or it could be that something's starting to go wrong with my wiring, okay? Now the next thing that happened, we're gonna meet at the mall at 2 o'clock. What happened to the word Macy's and my association with that new store? It's just not there. I can't, there's no connection. The new data did not get wired into my hippocampus. I'm not able to hold on to the word, connect it with a location, and make it be something I could find. So when I go to the mall, what signage am I going to be looking for? JCPenney's. And so I will go right by that mall, and I will keep driving, and I will keep driving, because I know that it's got to be here. I can go over 300 miles. And then when I find the JCPenney's, I don't recognize, number one, how far I've driven and how long it's been. I don't think I've gone that far. I think maybe 15, 20 minutes. I mean, it was just slightly, a little bit longer. I have no idea how dangerous I have just made my life and how challenged you are by what I'm doing, because I can't hold on to that data because my hippocampus is not necessarily registering accurately. So this is why we have so many of those things where people get turned around. It's my wayfinding that's challenged by this. Now again, this is a highly vascularized blood supply area of your brain, so it's high risk for strokes, but it's also one of the very first places that for many types of dementia we see damage. And so the challenge is they can't figure out how to get from place to place. Once they're in a place, once they get to the place, they recognize all the cues about the place. It's just getting there and getting back. And these can be, by mid-disease, these can be really familiar places. And so they're standing in the house, and they say, where's the bathroom? And your heart drops, because it's like, well, Daddy, it's right down the hall. Well, when did you move it to right down the hall? Because now what I have, do this. I have an overlay of this new data, but the old data is the house I grew up in. And I'm literally picturing the house I grew up in and where I would find the restroom. And this is not matching. And so I'm almost immobilized, or I'm frustrated because I thought it would have been right there. And so my question to you is, when did you move it? And what does your brain go? It's exactly where it's always been. Because these layers do this. These layers are clearly separated. Do this for me. They're starting to interlock and get messed up. And so if you look like somebody who was in my life a while back, I may make a mistake and think you are that person, because I'm losing the layering of time in my hippocampal area, just like I'm losing my space placement. Time and space are controlled by your hippocampus. And I'm starting to lose that skill. And directionality. Can't do it. So the next thing that comes up, so we have that one, and then the next one. I like caramels and you like. Now, I want you to take this one. The first words people who have cognitive change almost always lose, they almost always lose nouns first. They lose the names of things because they're highly specific and you have to get to a particular location and then you have to articulate it. One is getting it in and the other one is processing and the other one's getting it back out. So you have, it's really complicated. You've got to receive, you've got to process, you've got to send out. This is all these guys together. But let's look for a word, push it up like this. But I can't find it. So here's what I want you to do. When you have not normal, go like this. Yahoo! This is my attempt to describe the word. What do you notice about how far away from the word I am? Pretty far away. And so your brain is going, huh? Because when you describe the word, it was a short circle. There's actually a term for it. It's called circumlocution. I talk around the word. So I called it a brown hairy ball in the brown stuff. And I can tell most people in this room, if you've never heard me do it before, your brain automatically went, ooh. What? Because in your mind, for 90% of you, you went to a sexual image and it wasn't pretty. Admit it. Many of you don't want to admit that's what you actually pictured in your mind. You pictured a ball. It was small. It was hairy. And it was covered in brown stuff. clean that up. Especially caregivers, you were for sure thinking this. But let me ask you, what does the outside of a coconut look like? It's a brown, hairy ball. And what I was trying to do is describe coconut, but I couldn't find a lot of the descriptors, and so I had to go to the outside of the coconut, realize that I'm describing it visually. A brown, hairy ball in the brown stuff. Then I lost a second word, chocolate. And so I'm left with these brown stuff is vague. So I want you to do this. I'm looking for something. I want to tell you something. You know, the whatchamacallit, the thing that it is. You know, the thing that is the thing that goes around the thing. You know what I mean? The thing that you put in. The one who comes by and does the thing that he does with the thing. And you're going, I have no idea what you're talking about. Because your brain, do this, if this is what I'm doing, your brain is going, how about this? How about this? How about this? How about this? And your brain's going, there's too many options. I don't know what to pick. Your brain's, I don't know what you're talking about because we're expecting this. That's not what you got. And so this is frustrating for who? Both of us. We are both incredibly frustrated by this lack of skill. We get so frustrated, we get stupid about it. And you turn to the person and I say, turn to your partner or somebody near you now because you may have switched up. I want one of you to say, I need something. Go ahead and say that. And I want the other person to spontaneously react to that.
I need something.
What do you need?
I don't know.
What do you need?
It was there a moment ago.
What do you need? Yes, what did you just ask him for? I want you to realize how stupid you are. I want you to realize how dumb that was. They said to you, I need something. Obviously, if they could have thought of the name of the thing they needed, what would they have said? I need a... So what did you ask them? The thing they couldn't do it. Why do you think they didn't do it? Because they couldn't think of it. Now what you're expecting is this. With dementia, good luck.
She'd be a good comedian.
Yeah, she's funny, right? So you guys already did the I need something demonstration and realized if you were someone with dementia, what that might look like trying to find that word, right? So let's just kind of go over what we learned today. That was our last TIPA video, and I just want to kind of review with you. So what are some aspects or some qualities of normal aging that we discussed?
Forgetfulness. Why
Forgetfulness.
did I go into that room?
Yeah, forgetting why you came into a room.
Slowing down.
Slowing down, that's a big one. And the last one I want to bring up is for someone with normal aging, new data reminds them of old data. So they can make those connections between what they're seeing today and maybe what they saw last spring. Oh yeah, the daffodils were planted there. New data reminding of old data, right? What about non-normal aging? What are some of those features that we talked about?
There's been a commercial, somebody's looking for their keys. And when they found the key, what is it for?
Not normal aging, yep.
No.
What else do we talk about not normal aging?
Ann brought up a good one earlier.
What about the gentleman you were talking about who thought it was dinner time, but it wasn't? Being stuck in a moment in time and not having that time
That's right.
awareness on both sides.
He had drifted off, sleep in the van, then he woke up and he said, oh, I gotta get to dinner. And it wasn't dinner time.
Personality was another one that was brought up.
Yeah, you guys talked a lot about kind of personality changes. And what about those cues that we talked about? What is someone with non-normal aging going to struggle with? Processing those visual, verbal, and touch cues, right? So they might not necessarily be able to process those adequately, right? So one thing to know is that not normal aging is not always dementia. There are other things that can cause these symptoms. We talk about them, could be an acute illness like a UTI, a urinary tract infection. It can be stress, it can be lack of sleep. I've got a friend who's a new mom. She's definitely experiencing some of these pretty intense forgetfulness things that we would call not normal, but she's also sleeping about 2 hours a night. So there are other things that we look at when we see these not normal cues. It's not always dementia, but it's really important if we're seeing those in the people around us that they talk to a doctor, because a doctor is going to be able to tell them what cause that might be. Does that make sense?
And also medication changes,
It's true.
you know, with us, we see when there's a medication change, or they might be on the same medication, but a new manufacturer, so it's a different variety of that medication, so.
So amongst yourselves, with partners or however you want to break up, let's talk about kind of 2 things you learned and 2 things you're going to take away from this presentation. 2 things you want to incorporate, whether it's that hand under hand, whether, you know, whatever that looks like for you. So 2 things you learned and 2 things you want to take with you.
Since I came with you halfway through, over time of this talk, I've learned what you're,
I want to be more aware of the people around me.
and to comprehend all the different
I
sensory
can't help but
parts.
be aware of the people around me, because
Visual.
it's a very small unit, and a lot of the people, some of them are there because they have deteriorated over a period of time, like with MS.
Yes.
And that's
Over time, not,
and
sometimes it takes a while.
that's very hard. One of the ladies, I just got acquainted with her, and she's
For that often, but I talked to her.
in the hospital. Same time I was, and she was there for 3
She'll
years.
say to me,
I thought she was just, so they just kept her.
volunteering, it says we have a phone call with your, my doctor. No,
Hey, it's okay.
That's right.
It was nice to meet you.
Mary Ann.
Nice to meet you.
Dr. Newman's office called you and wanted you to call back.
Okay, okay. I have to go to the doctor in our office.
I'm just,
This is your husband that
Yeah,
just
this-
spoke
this
to
should
you?
be been more publicized
Tom.
in some way.
Time, yes.
Well, it's getting
It was nice to meet you.
Yes, you'll see
Okay,
it
so
working
since
together.
we're out of time here, I'm going to go ahead and wrap it up. What I'll say is we're doing another one of these talks where we'll get more into skills next month. So if you're interested in coming back and learning just a little bit more, we're going to do that next month, and we'll get those dates out to you. We've got 2 more talks on this topic with TIPA.
And they're 2 hours, right?
They're 2 hours.
Since I wasn't aware of it being 2 hours.
Oh, I'm sorry. Yeah, we'll make sure that all the
Oh, yeah.
details are publicized for the next one. We'll get the flyer out for
That's what you call
everyone.
the doctor's office.
So yeah, they're 2 hours each. Well, the next one will be the skills piece, the hand under hand. We'll do a little bit more of that. We'll talk about knowing what to say and how to do that kind of redirect that we talked about a little bit.
Can I do this and get it back to, not right
Should
now?
be somebody here.
Or
Sure.
not, I really,
Yeah.
Here's Jessica's card.
The last thing I'm going to ask for those who sat through the presentation is we've got some surveys over here that we have to fill out just to make sure that you're getting the information you need. There's also chocolate over there. There's my business card. There's some information about TLC, where I work and where I love to
What
work.
does TLC stand for?
Tender, loving care.
just like.
That's what TLC, the
just like
acronym
it
stands
is.
for.